Hi, Mr. Allen. My name is Veronica. I'm going to be your student nurse today. How are you feeling?
I'm feeling fine.
Good. I'm going to be changing the dressing on your central line this morning. And it's basically we just change it every few days in order to take the soil dressing off, clean up the area, apply new dressing to keep the area safe from infection. Okay?
Alright.
Before I get started, can I have you give me your name and date of birth?
Anthony Allen, 7797.
Okay, good. And tell me, are you having any pain today?
No, ma'am.
Okay, good. So at this point, I would adjust the bed. I would lift the bed to make sure it's high enough so that way I'm not straining or leaning over too far that it hurts my back. And I would put my patient in a semi-Fowler's position. I would gather all my supplies. I would gather an extra mask just in case my patient was not able to comply with turning their head to the side. And then I would come back in. So, and I would begin by cleaning my hands. Mr. Allen, can I have you turn your head to the left, please? All the way to the left. Thank you. And I have my bag where I put all my soiled dressing. To remove the initial dressing, or the old dressing, I should say, I would put on non-sterile gloves. You may feel a little bit of tugging at your skin as I remove the adhesive, okay? Alright, thank you. I would discard of that. Then I would be checking the area for any signs of infections such as erythema, swelling, any type of drainage, feeling if the area is hot to touch, or asking the patient if he has any pain upon my palpation.
No.
Okay, thank you. So I would get rid of these gloves, open my kit. So the gloves in this packet don't really fit me, so I just took my own gloves out. So the first thing I would do would be to put on my mask. And apply and put on my sterile gloves. Okay, now I would take my supplies out. I would just make sure I have everything out. Okay. So I would clean the area above and around the insertion point with this swab for at least 30 seconds. And I would discard of that. And I would if this was alcohol, I would take it and I would use it to wipe each of the lines to the bifabrication point to clean those. Then I would let it dry, would not fan it. Then I can apply the applicator underneath while I'm holding the central line in place so I don't pull it out. I want to make sure there should be some markings, some lines that tell me how far in the central line belongs. So I want to make sure the markings are right up close to the skin or close to the insertion point. I would insert this underneath and then apply my new dressing. When it's all done, so we get all my supplies, throw them away. After I finish cleaning up, I would label my sticker and put it onto the site to let them know when is the date that it was changed and who changed it, so the next nurse is able to change it, and then I'd be done. I would place the bed back in a safe position, so I would lower it back down, lower the patient's head back down based on the patient's level of comfortability, and I would make sure they have their call bell and put the railing, the side railing back up, and I would be done.